It's 9:11 now. Coming up on Good Day Atlanta, testosterone plays a vital role in women's health, but there's still a lot of misconceptions surrounding it. So up next, Dr. Corinne Erickson with Georgia skin specialist will join us to help decipher fact from fiction. Welcome back. Well, fatigue, mood swings, low libido. Millions of women experience these symptoms, but they rarely hear the real cause. So today we're talking about testosterone. Yes, women have it and they need it. So dermatologist Dr. Corinne Erickson with Georgia skin specialist is joining us to talk more about this. And Dr. Erickson, it's good to have you here. Welcome.
Thank you so much for having me.
Hi. Yeah, I mean, I gotta be honest, like even just amongst ourselves, when we knew that you were coming today, the conversation got going about, we didn't even know women had testosterone.
Women actually have 10 to 20 times as much testosterone as estrogen.
Wow.
And we have this misconception that testosterone is a male hormone and estrogen is a female hormone. Well, guess what, guys? We all have both of them, and we all need both of them for optimal functioning.
Wow. So this is actually something that you focus on in your practice. So what are you seeing? I mean, what are women coming to you and saying?
Well, they're complaining about their energy levels. They're complaining about their libido. I take care of a lot of women in perimenopause and menopause. So these are the concerns I hear about how they feel. But what I see as a dermatologist is that they go and they get these testosterone pellets implanted, or they may go on injections because they're in a rush to fix the problem. Then they're seeing me as a dermatologist because their hair's falling out. Their face is covered in acne, or they're growing a mustache, and we just don't want this for our patients.
Yes.
So
not the combo we're going for
Not the
here.
combo we're going
Yes.
for. So I'm trying to show patients how we can safely and effectively use testosterone without those unwanted side effects of hair loss, acne, and facial hair.
Okay, so you brought some of this today, so show me what you have.
I did. So this is how I prescribe testosterone in my clinic. And this is the FDA-approved version for men. There is no FDA-approved version for women. So 1 tube a day is the dose for a man. 1/10 of a tube a day is the dose for a female.
Okay.
And so if you use it as directed with 1/10 of a tube, so 1 tube should last you, 7 to 10 days, you should not run into problems with acne and facial hair and hair loss. When women go up to those male doses is when those dermatologic side effects really become problematic.
Okay, so the dosage here, very, very critical that you get that right.
It is, and it's hard because there's not this version available for women at the drugstore. So a lot of people will prescribe to compounding pharmacies for a female appropriate dose where you can do several clicks, 1 click. It's very dependent. But what I just want to make sure women know is that if you go from nothing to pellets implanted, that's like if you were walking a mile today and running a marathon tomorrow. You're going to get injured, you're going to have problems. Your hair is going to fall out, you are going to get acne and facial hair. So if you go on pellets, I hope it comes with a wig and a razor.
So why is that an option then that so many women are choosing? Is it just what they know about?
It's what they're reaching for. It's what's more broadly marketed to them, and they just want a quick fix. And because there's not an FDA-approved option for women, they go places where someone will just implant the pellets. It feels like the easy button, but it really is so much harder in the long run.
Okay, so that's something certainly to keep in mind. And did you already cover this one right here?
So this is a supplement, and I have a girlfriend who's very bright who thought that she was taking testosterone in the form of a supplement over the counter, because some of them say testosterone on the label. DHEA is usually the active in these supplements, and it can help boost your testosterone levels, but here's the issue. Supplements are very unregulated in the United States, and you may not get a very dependable dose titration that helps you get to a level you need. So I recommend talking to a menopause certified practitioner about your testosterone, because it has huge benefits for women with your mood, with your libido, with feeling like yourself again and having that get up and go in the morning.
Very interesting. I couldn't help but really hear what you said about there not being an FDA approved option for women. Why in the world is that the case? I mean, it seems like that's part of a larger problem here.
It is part of a larger problem, and it's part of a larger conversation and movement that's happening right now to help women get the hormonal support that we need. They just dropped the black box warnings on topical estrogen formulations and on hormone therapy last week through the FDA, which is a huge win. I'm really hoping that testosterone is next because the studies are there. The way that this can help women with hypoactive sexual desire disorder, the way it can help with cognition and brain fog, with muscle mass, with that energy level that we need to function. There's no reason that the FDA needs to be gatekeeping this from us anymore.
Certainly not. Doesn't make much sense, does it?
No.
Yeah, it really doesn't. So why do you think there's so much fear just surrounding the side effects of taking testosterone as a woman?
Because there has been this trend of not having access to an appropriate dose. Women have gone, they've had the pellets implanted, they've gone on the shots, and they've had this horrific hair shedding. I've seen it in my clinic, and it's tough to manage once that happens. And once the pellet's in, you can't take it out. It's that you can't put the toothpaste back in a tube example. So working with someone who understands formulations and how to dose it appropriately for women really is beneficial and can change your life.
So at what point should someone do that? Go and talk to someone like you.
Absolutely. So if you're not feeling like yourself anymore, if you're having trouble with that get up and go, if you're experiencing decreased libido, if you just don't feel like you're building muscle the way you used to, if you feel like there's just some kind of fog and heavy weight on your body, talk to a menopause certified practitioner about it because testosterone can help, as can estrogen and progesterone.
So where can we find you?
So I am at Georgia Skin Specialists, and I do see patients for all dermatologic concerns, aesthetic and medical, and I have a niche taking care of perimenopause and menopausal skin concerns. So I'd love to help women in the Atlanta area with these issues. They're important, they matter to your health, to your skin, and to your confidence.
Sure, and they make a difference.
A huge difference.
A huge
when done
difference.
right.
When done right. That's right. Dr. Corinne Erickson joining us this morning talking testosterone for women and the positive impacts that it can have on your life if used correctly. So thank you so much for coming in, Dr. Erickson, and talking about this. That's important to talk about this.
Let's keep talking about it.
Yes,
Thanks for having me.
We appreciate this.